Right. So reflection. Why is reflection important? Why are we doing a whole talk on it? Well, your ability to reflect is by far one of the most important qualities that you need to demonstrate through your personal statements and interviews. And it isn't just key for the medical school application process, it's integral to every single stage of your professional development as a doctor as well, and also as a medical student. You need to be reflecting consistently, but having a head start like this talk is always good. Um, and so what we would advise is that after this, you just sit down and think about what you've learned while it's fresh in your mind. Try and maybe keep a record of any interesting scenarios that you've seen. So for example, if you liked one of the scenarios that we went through, make a note of it and think about it, reflect on it. We'll tell you how to do that in a few minutes. And keep these notes ready so that when you're writing your personal statement or doing your interview, you know exactly what you're going to talk about. Admissions tutors reading your personal statements and the interviewers conducting your interviews are really looking out for reflection. It's absolutely a key skill for your application process.
So here are a few things that you can ask to reflect fully. So these questions can be used for any sort of event in your personal statement or interviews, not just for work experience or for volunteering. So you guys can have a read through these questions, but we've just highlighted the ones that we think are the most important. So how did the patient feel? So for example, when Gracie and Shwet were talking about their relative scenarios, how do you think the patient actually felt to hear the bad news about HIV? How did they feel about talking about their depression? And then subsequently, how did the patient act based on their feelings? So if we just take the HIV example, Susan Hepburn was quite shocked and was in denial. But what Chouette did was he took some actions to calm her down and to reassure her by breaking down the information into smaller, digestible chunks and really signposting where the bad news was. And then when you think about reflecting a little bit more deeply, what did you learn from the experience? Did you learn about communication? Did you learn about empathy? It's really important to think about this. And what skills are really important for a doctor to have? What allows them to make the patient feel comfortable? Is this communication, empathy, or so on? And finally, why is it useful for a doctor or dentist, because we might have a few aspiring dentists here as well, but why is it useful for a clinician to actually have this skill? And subsequently, how are you going to put this into practice? When you ask yourselves these questions, it's important that you don't just narrate the event, as the small details are less important. You provide a much better description by giving a specific example from your work experience. For example, just focusing on one patient-doctor interaction and then describing why it stood out to you. A really good way to do this is to show how you developed the skills you saw in another situation. And we have an example of a student that does this really well later on in the talk.
Yeah, so through this talk, we're just going to use some examples from people's past personal statements to show you exactly what you should do and what you shouldn't do as well. And seeing these and seeing analysis of these is incredibly useful, as I'm sure you'll find. And that's why we think that the personal statement pack that we were selling as an add-on to this event is so incredibly useful. But going through these examples, I'll read this out to you guys. Volunteering for 2 years on a program helping disabled young adults transition from the children's to the adult hospice enabled me to see patient-centered care beyond their diagnosis. I spent time with a young man who suffered from cystic fibrosis and needed simple conversations as a relief. I also interacted with non-verbal individuals, affirming the importance of maintaining patient dignity and treating the patient as a whole. Though daunting at first, With time, I developed my non-verbal communication skills through recognizing gestures and facial expressions. All right, then. So, just some quick analysis of this extract. So, we've taken this from the section of the personal statement, as you can probably tell, where they're talking about their volunteering. The student not only talks about specifically what they saw, so the exact event and what actually happened during their volunteering, but they also say what they learnt from this. And so they've reflected really nicely. They say after this that they learnt the importance of maintaining patient dignity and reflect on this further by showing that they've gone away and developed their nonverbal communication skills to be able to talk to disabled patients a little bit more easily in future. So overall, this is a really, really good example of how to reflect on events that you've experienced.
So here we have another example. During a vaccination at the age of 9, I fainted after the injection. The doctor caught me as I fell. Her empathy and compassion sparked my interest in a medical career. Ultimately, I want to study medicine because it combines the application of science through daily human interaction and fulfills my desire to give something back to society. So, just for a little bit of context, this specific piece of reflection was the introduction to a student's personal statement. So, even though the student does reflect, the link between falling and empathy is a bit tenuous. The student really needs to describe what exactly was special that the doctor did after catching them that shows empathy, because you would kind of assume that catching someone that falls is basic human nature. What really links to medicine here is not so clear. So if you paraphrase this paragraph, it would say, I fainted, the doctor was nice to me, and now I want to be a doctor too. So the link between what you saw and what you felt needs to be explained in a little bit more detail here.
Great. Now we'll just go through very quickly reflecting on your personal qualities because these can tie in to what you've observed and your own experiences. So when you're talking about your personal qualities, it's vital to think about your strengths and weaknesses, and as well, how might they influence your work? Think about the skills that you already possess, the important parts of those skills, and then give an example of where you've demonstrated them. So here's just a few questions that you might want to consider. So first of all, what skills or qualities do I already have? What does this skill or quality consist of? How have I demonstrated this skill? So for example, if we're taking leadership, as we were talking about earlier in the day with the doctor's, leadership was a really key skill. So leadership, you might say, consists of having a vision or direction for the project, as well as getting the right people involved in the correct roles for them in order to bring out their best work and then delivering a good result and so on. You also want to show the development of your personal qualities. So to show that you're capable of learning in a profession that places a lot of importance on continuous development. The field of medicine is always changing. So for this part, you might want to think about, when have you faced a challenge and why did you find it difficult? How did you solve the challenge? What new skills or qualities did you gain? And why might it be important for a clinician to have these skills?
So here's an example of a student that does this really well. By presenting my research in a way that the audience could easily understand, I appreciated the importance of good communication skills to convey a message clearly and succinctly. I applied these skills at my placement in the renal, ENT, and audiology departments at Whipps Cross Hospital. The crucial relationship between doctors and patients was highlighted by the effort they made to make patients comfortable. And then they go on to explain how they've actually used these skills in a separate paragraph. During my time volunteering at a care home, a resident became unexpectedly aggressive, and I had to calm her down before help could arrive. So, as mentioned before, this is a really good example of reflection, as the student shows that they've acquired skills such as communication, compassion, and warmth. They've reflected on why these skills are important from a clinician perspective, but they've also developed these skills in themselves, and they use that example of volunteering at a care home to do that. Furthermore, they've linked all of these to a clinical environment through observing the doctor's efforts and in their own actions. So this overall is a really great paragraph from a personal statement.
Great. And now we come on to our Medapply formula. Now I know we've told you quite a bit so far, and this is quite a short talk, but we just want to summarize in a nice way that you can easily remember, and then go away and apply to your personal statements, to your interviews, whatever it might be, wherever you need to reflect, and even going further in your medical career. So to present your reflection, we recommend using the 3 E's. These are extract, elaborate, and evaluate. So starting with extract, you want to extract the specific events that influenced you. By specific events, we don't mean I went and shadowed a doctor on a ward. We mean I shadowed a doctor on a ward and I saw a patient with this condition, and the doctor did this specific action that improved communication, for example. So really hone in on exactly what you observed and then write about that. Next, we have elaborate. So you want to elaborate on the details of what you saw. And here you talk about the qualities or principles that the doctor or the person you observed demonstrated. And then finally, we want to evaluate the importance of this to your learning and your work in the future as a doctor.
So our take-home message is to reflect on the experiences that have deeply impacted you. The best examples of reflections will be given by the experience you feel most strongly attached to, even if you don't really know the reason why yet. Your example doesn't have to be something that's extraordinary or really impressive, especially as in the pandemic, it's hard to come by such opportunities. And by this, we mean things like shadowing a surgeon and viewing a really complex procedure. You could take something a little bit more simple, but reflect on it effectively because it's affected you. Your feelings towards your activities and your experiences will ultimately influence how you reflect on them. If there's a project that you're currently working on, such as your EPQ, that you're enthusiastic about or passionate about, and you're really interested in it, dig into this deeply. It will give you much more deeper and meaningful reflections than reading a difficult journal article or a book that you don't really have any interest in. When it comes to your interviews, it does become quite obvious when the student isn't interested in and hasn't reflected on something. By choosing things that are actually interesting to you, it will make the process a lot less arduous as well. So overall, the key to really standing out in your medicine application process is reflection. So pick out the activities you did to contribute to your medical application and the reasons why you want to study medicine, and relate this to desirable qualities associated with your activities or your experiences. So in terms of how to actually use all of this information in your personal statements and interviews, we will have further webinars on this and take you through it in a little bit more detail. But this talk is just to give you a starting point about how to reflect. The sooner you put these principles into practice, the better, and it will become quite natural to you. And that's the end of the talk.